Hey everyone, it's Sara Howe. I'm back for another episode of Connections by APNC. This one's really personal for me. We have Tym Rourke. He's the Managing Director of Community Health at Third Horizon Strategies, a place where I once had the privilege of working. But what's important here is that Tym and I have worked together and known each other for over 20 years. And he has such an incredible story that I won't give it away. You'll have to listen. But he has such an important story that, like we talk about, makes a lot of connections to our work. So we'll chat about it after you listen. But I'm so excited for you to be able to hear from Tym today. Welcome to Connections, the podcast from addiction professionals of North Carolina, where we explore the nuances of addiction and mental health through the lens of policy and practice.
We're your hosts,
Sara Howe
and Morgan Coiner, and we're here to help you see how it all connects. We are so excited to be here live at the 2024 Spring Conference in Lake Junaluska. We have the opportunity to be here with over 300 guests and people working all across the continuum of substance use. And we are excited to get to bring you some in-person interviews with some incredible speakers.
So today, this is really exciting for me because I get to interview a longtime friend. We'll leave the number out, but for many years that we have worked together in this field, Tym Rourke, who is the Managing Director, Vice President at Third Horizon Strategies, which is one of the firms that APNC has worked with for a long time, one of our partners. And we're really excited to have you back at the APNC conference. Tym.
Thank you very much. It's great to be here.
Tym and I go back to our Teen Institute years. For our listeners who are not familiar with Teen Institute, as we were earlier talking, T.I., we are not discussing the rapper or his songs. We are talking about a leadership program that goes back 50 plus years in this country.
Yeah.
To clarify, y'all weren't there 50 years ago.
We were not there.
You said
Let's
you were going to leave the
clarify.
number
actually,
out, so I do want to give y'all some credit there.
Yeah. And actually, it might even, is it 50? I was wondering if it's even more than that. It was 1967.
It's more than
In
50,
Ohio?
I think.
Yes,
Was the
Ohio's
first.
50 plus, right?
Yep. Because I grew up in New Hampshire. In New Hampshire, they put 2 kids and 3 adults on a train to go participate in this program in Ohio for youth. And they liked it so much they brought it home. So
It's
awesome.
It's a program that still exists around the country.
it does.
It still exists where I first started, where I went as a Teen Institute kid in Illinois, the second Teen Institute in the country. But it's grown. North Carolina has had a Teen Institute for many years. I think now it's paused, but we've had one. Some of our neighboring states have had it. Georgia runs one very regularly. Mm-hmm. New Hampshire.
Still going strong.
Still going?
Started in the early 80s. I was, I think, 1988, so I might date myself a little bit there. But yeah, it's still going strong every year, which is great to see.
And it's something that we don't talk about. And we're going to pivot a little bit here, but I do want to mention, we've talked about the workforce a lot throughout this podcast, but we don't talk about the value, I think, of prevention. And yet what we have talked about is everyone's got an origin story, and mine originates at Teen Institute in this field. Like, why'd you get into this? I was a kid in TI, and I looked up at everybody on the stage and said, boy, that'd be really cool to do as a career. And little did I know what in the world I meant when I said it. So here I am years later, and we're still talking about it, right? And it still exists. And so there is a workforce component to prevention.
There really is. Now, I actually, because when I speak, I will often share with folks, I'm not a person in long-term recovery. And I think when we think about the behavioral health field and the substance use field, a lot of people in recovery have turned their recovery into a career and have entered this field. And we don't often talk about it. And I've always said, I'm not a person in long-term recovery. I'm a child of prevention. And it was getting turned on to the idea of social change, to an appreciation of the injustice that people faced when they struggled with substance use and how substance use impacted adults, but also impacted kids who were growing up in homes where substance use was an issue at a time when there was a great deal of stigma. And even those young people, many of my friends couldn't talk about it. And so, I think back to my tenure as a kid in those prevention programs. I went on to volunteer staff for them. I graduated from college. I went to work for them for about 7 years. And even now, as I look around, there are teachers and social workers and educators in our state, healthcare professionals and others who I know because they were alumni at Teen Institute. And I do think it's sort of there is this secret cadre of people in the workforce who are touched by that too. And I think that speaks to the workforce power and potential of the entire continuum, and what you can do when people are impacted by substance use prevention services and other kinds of services at a young age.
Yep, there definitely is. And I think the reason why we wanted to really chat with you today is we've been doing this work in this field. We were children of prevention. We wanted to continue to make a difference. And what I find so fascinating about your story, and it's probably a lot of people's stories that we don't talk about, is we have our own stories at home with addiction and mental health, right? And so you have been very open and very public about your son's pediatric cancer journey. And Tim was really gracious with his time and did a keynote in the fall for us talking about preparing for the unexpected and what it's like to be a new parent with an 18-month-old.
Yeah, he was about 16 months old when he was
16 months
diagnosed.
old with a rare, very rare.
Very rare. And, cut to the end, he's 19. He's relatively healthy. He's one of the only long-term survivors of his particular cancer in the world. But that experience, even I had been in the addiction field for years prior to that. But to see what it was like to have a child with a life-threatening illness and how community and the healthcare system rallied to do everything they could to support him, to support his family, how the community rallied, and sort of juxtaposing that experience with the stories I had heard at the time from countless families whose children were not struggling with cancer, but might have been struggling with substance use or mental illness, and finding systems so incredibly broken with illnesses that are in many ways very similar to cancer. They're chronic. They're often relapsing. Two people can have the same type of breast cancer, and one form of treatment will succeed with person A and it won't with person B, and we don't know why, but that's just part of how the healthcare system understands continuing the need for research and figuring out, what we nowadays sort of call person-centered care, right? Individual care. Whereas in substance use, there's stigma. People think treatment doesn't work because if people are still struggling, that must mean the treatment's not effective. And so it became an opportunity for me to, I think, help others understand how crazy it is that we have built a system to treat diseases of the mind and diseases of belonging so radically differently than we treat any other healthcare issue. And very often, when I share my son's story and the way in which, from the moment he had what turned out to be a seizure until the moment he was diagnosed and then brought into the right level of care, when you walk through what that process is, I think it opens a lot of people's eyes around how it seems so nonsensical the way we in our country treat behavioral health. And I think in particular because, pediatric cancer is seen as this, it's a warm and fuzzy story on the 5 o'clock news, right? That child who gets a Make-A-Wish, heartstrings are just naturally pulled when you see what families in the cancer world will refer to as bald, shiny kids, right? There is just this way people respond that is so very different. And so it's become a real clarion call. Little did I know I would sort of have the opposite in reality, which is I also now have a daughter who has gone through over the last year some really significant mental health struggles. And living through, again, some of those inconsistencies, where recently my son testified at a legislative hearing on a bill around equitable insurance coverage for emergency services for kids in mental health crisis. And he talked about being a cancer survivor and how crazy it was that he was able to get the right services at the right time. And it is literally the only reason he's alive today. And yet for his sister, who similarly had a disease that was not her fault, that we know is progressive, that we actually know there are treatments that work, we spent a long time fighting to find services that either were not there or were inaccessible. And he kind of called to task legislators to say, like, you know, we don't have arguments about choosing whether or not a kid like me deserves cancer treatment. Why are we having arguments around covering the same kind of treatment, the same interventions for people whose illnesses might just be slightly different?
What kind of reaction? Sorry, Morgan.
No, go ahead.
What kind of reaction do the legislators have to that?
They were furious. I mean, the bill specifically was to, while, you know, as we all know, parity is super important, but we've learned as parity is rolled out that it's parity means different things to different players. And I think kids services in particular are often overlooked in behavioral health. So in our state, part of the challenge was that insurance companies don't cover emergency services when a child is in mental health crisis. So intensive home visiting services, other types of emergency respite care. There are just things private insurance won't cover. So what has ended up happening is that in addressing children's behavioral health broadly, our state, to their good credit, made those services available in Medicaid. But the challenge is kids with Medicaid aren't the only kids who have behavioral health challenges. And so the bill was to require private insurers to cover these services, because what's happening now in the state I live in is that if a child meets certain criteria to be in mental health crisis, as my daughter did, they have the option to enroll in Medicaid, which means the state is paying for services, but we have private insurance. And there's an argument to be made that that should not be the state's job. You know, so I think it fired up the legislators, both to sort of hear the injustice of it, but again, also to have a child who had a very different, but equally, if not more life-threatening disease, walk through his experience of what that was like for him and how powerless he feels as a sibling because of it.
I think, boy, there's so many different things wrapped up in there, but the fact that your son at 18, 19?
19.
Went in front of the legislature, was very vulnerable in sharing his own story and the impact of a sibling's mental health disorder.
Yeah.
And we all, as we sit in this room, have been touched in some way by addiction, mental health, or both, right? And as we talk to our listeners, how many of them have been touched by addiction and mental health? And yet sharing those stories is harder than sharing oftentimes the cancer story. I'm a breast cancer survivor myself, and my experience with breast cancer is very a similar one to you. I remember going to the cancer center and thinking, wow, it's just, they wrapped your arms around you. They're like, here's your oncologist, here's your radiation oncologist, here's your oncopsychologist for your social work needs.
Right.
I mean, it was just, it was understanding you're going to have some issues because you've been diagnosed with what could be a fatal illness. And we want to wrap that around you. And here's your wellness center. And it's all in one building. And I still have friends today that are some of my most important people in my life that I can call when I have those moments of, oh, is it going to come back? And they're there for us. And yet, as we look at the numbers of people in our society struggling with addiction, struggling with mental illness, the stigma to get that support still exists.
Well, and I think you've both sort of said this without saying it, but it's like at some point we decided cancer was worth treating, right? And we collectively as a society have not quite seemed to have made that decision about addiction and mental health. Yeah. And I think that's changing. And then on top of that, there is the issue of, well, treating those things for children under 18 brings a lot of liability. So like, we're not going to take that on as a facility. Like I hear that a lot from different facilities I've worked with, like over my career in the field of just like, it's a huge liability. There's a lot of work you have to do to be able to accept children. And I'm like, yeah.
Well, I also think, I mean, with that, you know, to Sarah's point, there is this, it's community acceptance. There's this sort of natural reaction. I mean, cancer used to be the C word. I've been in the cancer community long enough to have, when I was doing sort of parent advising work with the cancer institution where my son was treated, I met people who had cancer treatment in the 50s and 60s when it was the C word and you didn't talk about it. So it's another reason why I use that as an example, because it had a similar, it did have some similar moments. Now, granted, we didn't criminalize cancer, but I think one of the challenges is also that with, a cancer diagnosis, even just saying the words connotes a sense of urgency. And now granted, my son had a brain tumor specifically. There are some cancers that, I'm a 3-time skin cancer survivor. It's slow growing. It can be dealt with. It's not an emergency, but there are cancer diagnoses that you can receive where you need to do something right now, and every second counts. And the system is built with that urgency understood in how patients are engaged. My son had a seizure on a Sunday and had a neurosurgeon in his brain Tuesday morning, right? And then we had a full diagnosis 2 days later and a treatment plan the day after that, like within a week. One of the most traumatic weeks of my life, but we had it. Yeah. Whereas, we often don't. My biggest concern right now in behavioral health is kids, because I don't think we appreciate the crisis that is happening for children, and that time is of the essence. Addiction and mental illness both are children's diseases. They start in childhood, one way or another. Yeah. And yet when children or adolescents begin to manifest concerning symptoms of either or both, there's a lot of hand-wringing or excuses that we can't build it, or wait times, or there's no clear way for kids to get to A to B. And from a prevention standpoint, severe, with some exceptions, obviously, but again, these are progressive conditions. The earlier you intervene, if you intervene at the first sign things go awry, not only is it more cost effective, the outcomes are better, and you prevent possibly years or a lifetime of misery. And what ends up happening instead is that kids get stuck with services they can't find, families get stuck with systems they can't navigate, and the children get worse. And then by the time they're caught and brought into a level of service, it's a much more intensive level of service, it's much more expensive, and the length of time it will take to potentially heal that child and heal that family gets only longer and longer. And I think that we don't see in community that as much urgency around kids and behavioral health as I think we need to.
I think one of the things that stuck out in my mind from your speaking in the fall was something that up until you said it, it made perfect sense to do it until you said it. And then you said, going back to the cancer, what we've seen and wrapping around it. And then you're like, and what we do in pediatric behavioral health and adult behavioral health is we hand you a resource directory. Here's a document with some numbers. They may or may not be right. The people may or may not be there anymore. We're not even sure that they do the services, but here you go. Off you go. And in our field, we've been building resource directories for good reason, right? So that people know where to find it because we're so fragmented. And yet when you said it in the fall, it was this light bulb like, oh, well, yeah, that's not what I was handed. Nobody said to me, Sarah, you have breast cancer. Here's a directory. Good luck. See you later.
Right.
At all. And how do we have to evolve?
We do. And I think it requires also, because I think directories tend to sit on shelves. And, in the regular healthcare system, it's not that everybody knows everybody, and my son had a particular diagnosis, which was, as I said, incredibly rare. He was one of 32 kids in the world diagnosed in the year he was diagnosed. And in comparison, like pediatric leukemia, 15,000 American children get it every year. So super, super rare. Wow. So it's not as if we need that teacher, that guidance counselor, that frontline person that might identify the child to be the knowledge holder of everything. But they need to be able to very easily at least be able to say, I can get you to point B. or the pediatrician being able to say, I can get you to point B. And in the work I've done where pediatricians have said, I don't ask about substance use because if a child says yes, I don't know where to send them. I mean, it's crazy making, because if a child walked in their office with signs of leukemia, they would know exactly what to do. And I think that's the kind of infrastructure we have to build. Yeah.
There's so many takeaways from today, and I don't want our listeners to feel overwhelmed or, wow, we've just spent the last few minutes talking about our system and what we need to fix. We have come a long way, and I think you made a good point when you talk about cancer treatment. It used to be the C word, or we would whisper it, and I had an aunt diagnosed with lymphoma, and I remember very clearly in the 80s being like, that whisper, right? And we've evolved in cancer, and we have evolved to the point where I can now remember multiple U.S. presidents, regardless of their political affiliation, mentioning opioids, mentioning addiction, talking about suicide. We're having these conversations. Unfortunately, we're having them because we're seeing in communities, we're seeing more of it, but we're having them. And so I think what's important today is we are talking about what we see in our field, where we'd like it to go, and we can look at other fields and learn from them. I think that's a critical piece of the conversation.
Well, I think we have to. Like, if it's working in cancer, why can't it work in behavioral health, right? Like, there's no need for us to do more work than we have to. And it's not necessarily a direct correlation, and that's oversimplifying, but if people have built things that work, we should use them.
Right. And I think that with the opioid epidemic and just the generalized public awareness, you're seeing that kind of progress towards lesser stigma. You're seeing people in recovery come out. You're seeing families who are caregiving for people struggling come out themselves as moms and dads and caregivers, which is huge in being able to sort of reduce that stigma and open up that dialogue. And I think, it does present, particularly for kids, an opportunity, because I think that the task for all of us in the field and in the industry is to go back to that point that addiction and mental illness are children's diseases. And so as we build and continue to grow our capacity to serve adults, we need to remember that many of those adults have kids, and those kids need support too as well. And the same way we've been trying to more rapidly build access to care for adults, we need to do it for children. And because I also think, as we come out of the pandemic, many, particularly schools, which are often the first line of defense, schools are really clear that they are beginning to see, as we fully expected, a lot of kids struggling, coming out of a pandemic, coming out of years of unusual isolation and strange educational systems, stuck on Zoom screens for years. So I think it is an opportunity to kind of ride the coattails of the growth and progress we've made to better treat adults, to do something to treat kids going forward.
Well, we appreciate being able to take that deeper dive and a little bit of a journey down memory lane with Tim.
Likewise.
Back to our Teen Institute years. And of course, we expect we'll probably be having you back over the course of this relationship with APNC, because we really appreciate your feedback and what you're seeing on the ground across the country with the work that you do.
Thank you. Well, and North Carolina is lucky to have you and all the work that APNC does in the state. So thank you for everything you do as well.
Welcome. It's a joy for both of us.
Yeah.
All right, what an amazing episode. First of all, the story of Declan and his pediatric cancer and surviving. He was one of 32 kids in the world. I have to tell you, I remember that day that Tim told me Declan had cancer. I can still picture that call, and I can still remember all of us rallying around him and worrying about him. And that's not unlike the work that we do when we treat others that are suffering from addiction. So the connections that Tim has been able to make, I'm a cancer survivor myself, and so it hits home. We do treat cancer differently than we treat addiction in this country. So having Tim have that credibility and that vulnerability to talk about Declan, talk about his family, and then continue this work and continue to be an advocate. I'm so glad you were able to listen to it today and see the work that he is doing to continue to change communities across this country. I hope you'll come back for next week's episode. Thanks.